As reports of EEE and West Nile virus continue throughout the region, we took to the streets to ask what your questions are about the diseases. Dr. Sharone Green, our infectious disease specialist, provided some answers.
What exactly is West Nile virus?
West Nile virus is a virus that is transmitted to humans by the bite of an infected mosquito. In nature, West Nile virus actually persists in birds and is in a bird-mosquito cycle, and that's how it's naturally transmitted. However, sometimes by accident, man, who's not the natural host, will get bitten, and that can result in an active infection and possibly lead to clinical illness. People who are outdoors and active are susceptible to West Nile virus because that's where the mosquitoes are, they're outside. People over the age of 50 are considered to be more susceptible to severe disease, as are people with what we call immune compromise, people who are getting chemotherapy, pregnant women, people on steroids, etc. Children can get infected and get a lot of mosquito bites. They don't seem as susceptible to getting severe disease, although it's been reported.
Why do we have to wear so much bug spray?
That's a very good question. The reason you wear so much bug spray is to protect you from the bites of infected mosquitoes. Mosquitoes can transmit some viral diseases, one of which is called West Nile virus, another is called Eastern equine encephalitis virus, and those can make you sick. So the bug spray, even though it's pretty yucky, is going to keep you safe. The added protection from a particular bug spray that contains DEET is that it will also protect you against ticks, and ticks also can produce a lot of human diseases. So keep wearing that bug spray.
How do you know which towns and areas are infected? I mean, is it my area? Should I be nervous about it? Or these are questions that I have right now.
So the best way to know whether West Nile virus is a problem in your town is to check your town's local website, and they will let you know about the concern level for your community. Having said that, the state does routinely test mosquitoes for West Nile virus, but there's a delay from the time of collection until the time of reporting. So just because your town does not have West Nile virus now, because of the way the virus now seems to be spread across the state, I would continue to try to protect yourself from West Nile virus, even if it's not reported in your town.
What are the treatments for EEE and West Nile virus, and do they differ from each other?
So unfortunately, there is no specific treatment for West Nile virus or EEE. If your doctor deems that you're ill enough, you'll be brought into the hospital, for example, for intravenous fluids and what we call supportive care.
Are pets and animals safe from West Nile virus?
Horses actually are susceptible to West Nile as humans are and can develop what we call encephalitis. However, if you're concerned about your cats and dogs, the good news is that there have been very few cases of clinical West Nile virus reported in cats and dogs. It seems that dogs don't get symptoms at all, and cats might get a little bit of sleepiness, but chances are that pet owners won't really notice.
How do I recognize the symptoms of EEE or West Nile virus?
West Nile virus frequently causes no symptoms at all. 4 out of 5 people don't even know that they ever got infected. Of the 20% of people who do get infected, they usually get what we call West Nile fever, which is fever with flu-like symptoms, swollen lymph nodes, and maybe a rash on the front and back of your body. EEE and West Nile virus also can cause neurologic disease. They're a little bit different in the fact that EEE frequently starts with a more abrupt kind of headache, nausea, vomiting that will last for a few days until people become more ill, whereas West Nile virus can sometimes manifest more gradually with a flu-like syndrome before you actually see any neurologic symptoms. However, any kind of symptoms like headache is very severe headache that won't go away, seizures, change in your mental status or confusion, you should go and see a doctor immediately.